I hope everyone had a wonderful holiday. Great start for the new year. Oh, I am not seeing Michelle. So we're going to go ahead and let Jessie start. So you guys, I'm going to go ahead and introduce, we call her Jessie. Jessie is actually from the AgriSafe Network, but she has a wonderful nonprofit that we would like to share for you today that goes along with everything that we're trying to share within our AgriStress meeting. And Jessie, I'm going to I'll stop sharing. I'll let you introduce yourself, maybe first as what you do for AgriSafe, and then go
Sure.
ahead and go into your nonprofit.
Perfect. And I actually do talk about that a little bit too. So we'll just go ahead and get started, I think. So thank you everybody so much for coming on today. You guys can see my screen, I believe, should be able to. Okay, perfect. So as Carrie said, my name is Jessie. I am a wife and ranch mom of two kiddos in the Nebraska Panhandle and in Eastern Wyoming. I am the founder and CEO of Foster Love with Beef, which we'll talk about here a little bit more. And for the past about 20 years or so, I have been in healthcare for the past 15, which is crazy. I've actually been a registered nurse. So currently, like Carrie just stated, I do work for AgriSafe Network. I'm the professional development coordinator. So I really coordinate kind of all the things, all the pieces of any continuing education that we do, very involved in the different trainings. And just it's been a wonderful opportunity that really blends kind of all of my worlds together, which I really, really love. And I've been very fortunate to be a team or a member of the team. I just started with them in July, last July. So we've done a lot of stuff in the last few months, which has been great. I am also a home health and hospice nurse in my community. I live in a little town of 200 people in Northwest Nebraska. I am a volunteer EMT in my community as well. It just kind of fits my world and just a great thing that I'm able to do and kind of help out. And I'm also a former foster mama. So I would like to just kind of start off with really the overall purpose of Foster Love with Beef. So Foster Love with Beef is really a way for our local farmers and ranchers to help the foster care community by providing beef to foster families when they welcome a new child into their homes. Now, it may seem like a little bit, but a little beef really does go a long way. And I apologize if I'm a little shaky. I haven't really shared this whole story before. So I was telling the girls before, I hope I can hold it together. And I have faith that I'm going to. So I wanted to share again just a little bit of how this kind of works. So when a child is placed into a foster home in a county that we support, Foster Love with Beef is contacted. From there, we reach out to local farmers and ranchers who have signed up to be donors to see if now would be a good time to donate. If so, donors deliver beef to the local office, who then assist in delivering beef to our foster families. So one kind of set of beef is 5 pounds of burger and a roast. So as you can see here, the circle kind of shows, or the circles show the counties that we serve currently. So we have 4 counties in Wyoming that we just added in 2024, and we'll talk about that a little bit more, and then 14 in Nebraska. And we do kind of continue to move east. And I just live like clear up here in this itty bitty, oh, I see a little different than you do, right up here in this itty bitty corner of Nebraska. Now, I think it's important that I share a bit about how Foster Love with Beef came to be, just to kind of help give a little context. So a friend and I were recently doing a Bible study actually on strength, where we were discussing the importance of weaknesses and especially sharing these weaknesses. Foster Love with Beef came up in our conversation, and she encouraged me to share my weaknesses and the strength that came from those. So here we are. Foster Love with Beef is a program that was born out of love and out of grief. Now, my husband and I got married in 2014, 11 years ago, which is wild. We thought that we had it all. You know, we were so excited to start our family. We were young. We're very naive. We had a plan. We were going to have 4 kids, 2 years apart. We were going to start the next year. We were building a house because we were in like a very rundown house, had good jobs, thought we'd build a house when we still loved each other. We quickly learned, though, that when we try to plan too much, God may laugh and teach us a lesson or two in the process. Now, the years that followed brought a lot of loss, a lot of pain, of grief, and of sadness. But most importantly, it brought growth. It brought hope. And in 2019, after 5 years of infertility, we felt that we had a lot of love to give. And after 3 pregnancy losses of our own and no real reasons for why, we knew that we wanted to share that love. So we opened our home to foster care. It had been on our hearts for a long time, and we felt that the timing was never going to be perfect, so we jumped in with both feet. We actually did our classes 75 miles away at the tail end of calving season. Was not ideal at all, and I'm sure you can imagine how unimpressed my husband was with me when I brought this up to him. But ultimately, we knew that we had to do something. And we were blessed to have 6 kiddos in our home. When the first group of kids, which was 4 kids under 5, or 5 and under, I should say, it was 5 to a twin 4-year-old boys and then a little 18-month-old girl. We were trying to explain to the 5-year-old that this, like, kind of why they were being moved again, this time to their adoptive home. I think they'd been in 7 homes or so at that point. And when we were explaining this to him, he said to me, "So you're protectors from God and you love all the kids?" And he was so right. Even though it was hard, we knew that we would say yes again. And we did a few months later. This time, the kiddos stayed with us much longer, one of them for the next 17 of his 19 months of life, but we'll touch on him a bit more later. Now in 2020, one of our kiddos did transition to a new home for a few different reasons, and we were blessed with the birth of our daughter, Olivia Grace. Near the end of 2020 and going into 2021, our foster son started having more visits with his mother, which was good. And it was also very hard on all of us. So you can see here, this is when our daughter was born. He loved his little sissy. They were Irish twins. His birthday was just after hers. And then this is just him out helping us on the ranch, which he did a lot of, and it was great. As our foster son, who had been with us for 17 months, transitioned home at the beginning of 2021, there were many mixed emotions. During the time he was in our home, we lived a lot of life. We had many dear memories, as you could see in the previous slide. He wasn't just a member of our family, but he was also a member of our village. It was hard and beautiful. To see his mom work so hard to get him back those last few months was something that I will never forget. During this time, though, my heart was aching for what I knew was to come. Our family and friends were hurting too. When you're fostering, your village is incredibly important, and even more so when you literally live in a village of 200 people. During the transition, my husband and I kept thinking how we could continue to be involved in the foster care community, but maybe in a different way, as we were unsure if we would ever be able to say yes again. Like we said, we are ranchers in the panhandle of Nebraska, and we found the kids in our home really enjoyed nights when we cooked with our homegrown beef. They also loved to learn about ranching and caring for the livestock. We had an older boy who was 11, had him for about 6-8 months or so. And in that time, he ate anything that we would make. And it was so fun watching him get involved. And I remember at one point, he kept telling us, like, "I don't like steak. I don't like steak." Well, come to find out, he didn't know how to use a knife. So when we taught him that, boy, he really changed his perspective on that as well. Now, March of 2021 was the month that our lives changed forever again. I really had no idea what to expect, but I decided to be the person to hand our foster boy back to his mom for the last time. Through tears, I gave her a big hug, told her how proud of her I was, but inside I was breaking. My family was breaking, and honestly, our village was breaking, and they were begging us never to take kids in again. Sorry, I knew this was going to happen. All right. So right about that time is when Foster Love with Beef came to mind. It was perfect. Local ranchers and farmers making a difference in the lives of those providing and in foster care. Nutritious beef for these kiddos and families to enjoy, all donated. We reached out to a few friends and families to gauge interest via social media, truly a Facebook post, and the response was incredible. In June of 2021, we had the paperwork officially completed and Foster Love with Beef was born. Despite various setbacks, challenges, and honestly, my mental health, it wasn't in the best place after our foster boy left. We persevered. And in October of 2021, our first beef delivery was provided to a foster family in the panhandle of Nebraska. Now, we also decided, because I'm like let's get it all done, that we wanted to not only provide beef at placement, but also a little extra at Christmas if we could. So we held our first annual Eat Beef and Be Merry Christmas giveaway, where each foster family in the Nebraska Panhandle was offered either a roast or burger, whatever their preference was, right around the Christmas holiday. Now that year, so in 2021, we provided just under 300 pounds of beef and supported 45 families between placement and our Christmas giveaway. We didn't know what this was going to look like in the long run, but we did know, if nothing else, that we made a difference that day or in those few short months. Now in 2022, we continued to provide beef to foster families at placement. We expanded our Eat Beef and Be Merry Christmas giveaway thanks to additional beef donations around the holidays. We were able to provide beef or a roast, as well as an additional beef product, all from local beef donors, mostly farmers and ranchers. To say that we were thankful was a huge understatement. In 2022, we provided just over 600 pounds of beef that went to 59 families. Now in 2023, we did continue to provide additional beef to families, as well as a roast and burger to each family at our Christmas giveaway, and also expanded our reach to additional Nebraska counties, scooching our way east little by little. We also welcomed a son into our home that year, so we knew that we had some balancing to do and felt that stability was probably a pretty solid move. So in 2023, we provided just over 900 pounds of beef to 82 families between our placement and our Christmas donations. In 2024, just last year, we continued to see growth. We were fortunate to be asked to have a table at the Nebraska Cattlemen's Ball in the beef tent, where we were able to meet members of the Nebraska Beef Council, who provided beef brochures on safe handling and recipe cards for our Christmas giveaway. We also recorded a segment on the Northern Ag Network about the program. We also felt that we were ready to expand a little bit because that's just how I roll. And with where we live, we opted to reach out to a few Wyoming counties, and we were able to add 4 Wyoming counties to the areas that we serve, as well as an additional Nebraska county for our Christmas giveaway. We were also able to create a website and speak to a couple of Wyoming cattlewomen's groups, as well as a couple local organizations as well. Now, 2024, like we stated, was another year of growth, and you can see it here. Having had nearly 1,200 pounds of beef donated and provided to 116 families in Nebraska and Wyoming. This year, for our Eat Beef and Be Merry Christmas giveaway, we were able to provide a roast and hamburger, as well as an additional item to foster families. During one of the pickups that my daughter and I were fortunate to be able to help with, one of the foster parents brought her teenage foster son in with. I opened up the cooler of extra beef and I told him, pick whatever you want, 1 or 2 items, whatever, because we have plenty of beef. And man, I will never forget the smile on his face when he saw those New York strips sitting on the top. He grabbed 2 packages pretty quickly and was very excited. And it just brought me right back to that 11-year-old we had that didn't know how to eat steak. So it just truly warmed my heart. So here we are. It's 2025, which is crazy. We've been doing this for 4 years already now. Now, I know we touched on this briefly, but I wanted to share a few more specifics, just kind of how the program works. So over the last 4 years, we have trialed a few different ways to get this to work. And what we have found to be the best way is we work very closely with the state. I was fortunate to have a good relationship with them from our experience as foster parents, or pretty good anyways. We ensure a set or 2 of beef is available in various offices in counties that we serve. When the office is out of beef due to being taken to placements, we are then notified and asked to bring X amount of sets into the office. So what we do, reach out to our donors in the area who, if it's a good time to donate that set of burger, remember 1 set is 5 pounds of burger and a roast, they're asked to take the beef to the state office the next time they're in town and just to notify me when the beef is dropped off. This is really a great way to ensure that local beef is being provided, as well as to ensure that proper handling of the beef, as that is something we always want to be aware of. Ranchers also know that beef is staying local and impacting children and family in their area, which they greatly appreciate. This worked very well as the caseworkers are already going to see the families for their regular visits, and they do so monthly, so it really has worked out very well thus far. Now, as stated earlier, we are now serving 14 counties in Nebraska and 4 in Wyoming. I work with 2 kind of primary caseworkers or supervisors in those regions, both of whom are excellent to work with. They see firsthand the impact of the beef on these families, so they're very thankful to be able to provide to families in their area. Soon, and I'm very excited about this, we'll be adding South Dakota to our list as well. That's my home state. I'm a South Dakotan at heart, so if you hear my accent every once in a while, I do apologize. We are also going to trial providing beef at reunification or adoptive placement too in the Panhandle, Nebraska Panhandle, as we have found that we often have people wanting to donate more beef in our area than what we have requests for, which is a wonderful problem to have. Now, in order for a new county or an area to get started, we do need to have a coordinator available. So this coordinator is my primary contact, as it's who kind of I work with when new requests are made. What these coordinators are asked to do is recruit donors, and then they reach out to donors when beef is requested in the area. Now, we're really just getting started with formal coordinators. It's more kind of a couple friends of mine who have done really well gaining kind of donors in the different regions that we donate to. But we're very fortunate to have these people already who are volunteers who know the impact of beef on health and mental well-being. So it's true, they've been very happy to assist. Foster Love with Beef has been a blessing in so many ways, not only to the foster families and kids in care, but honestly for my mental health too. Like I said earlier, I was in a really dark place after our little guy returned home. Maybe some postpartum things, maybe him leaving. It was just all a blur, honestly, looking back at it. And it's a day that I'm never going to forget. It really helped me And it just gave me hope, I guess, and helped me to see the good again and to continue to be involved in a community that means so much to me, just in a different way. It also provides a bright light for beef producers and a very tangible way for them to donate to a group that they otherwise may not have been able to donate to. One Wyoming donor recently told me how much she loved the program because she could see exactly where her donation was going when she dropped the beef off at the office. Now, this program came to us in a dream, so we continue to dream about what it may look like in the future. I believe this program has the potential to be available to every state in the US. However, of course, there's logistics that need to be in place for that to happen. Before we do anything else, we need coordinators, potentially in the different states and then in the regions within the state, to help coordinate those donations, deliveries, as well as to recruit in those areas. The power of networks is honestly incredible. Like I'd stated earlier, we started with a Facebook post to family and friends, and look where we are today. I hope to continue to share the benefits of beef in this program, as we know there are many. We want to share the benefits of the nutrition of beef to foster children who may not have had the best start in life. The benefits to producers as they're able to provide beef to local families and share their passion and their work, giving these producers that feeling of accomplishment and kind of helping the greater good. And of course, the benefits to children and families, foster children and families, having a sense of community and knowing that the agricultural community is supporting them in this foster care journey. I hope to be able to continue to share our story and give others hope that when they may feel lost, that there's light on the other side. By sharing, we also hope to see growth in various aspects of the program, from beef donors to funding, could help us just to compensate those working so hard to keep this program alive and to provide the various resources some of our sites have requested, like freezers, marketing materials for their families, things like that. I'd love to continue to expand our website and to streamline some of our processes, as right now it's mostly me and pretty manual. In order for this to happen, of course, we need some different funding things to get figured out, which we're very blessed to have more this year than we have had in prior years. And then, of course, I'd love to someday have a team with the same mission, just giving back to a community. Like we said, that means the world to us. And it's possible the more growth that we have. We are fortunate to have a great board who has supported us on this journey so far, and I know we will only continue to grow. But if I'm being honest, if we never grow and continue to provide beef to the families and counties that we're serving today, my heart will be full because I know the difference that makes to these families. I've heard it from them and the caseworkers time and time again. Years later, we're still going strong, expanding and providing more beef year after year. We're looking forward to continuing this program, and I'm thankful to have the opportunity to visit with you all today. Please feel free to scan this QR code, and don't worry, it is safe, to access a variety of resources from our website, signing up for our annual newsletter, to our donor form, our social media links. We are on Facebook and Instagram, which is just me, so I'm not the best at posting, but I'm trying to get better, as well as our merchandise collaborator, Mind Your P's and Q's. You can't see my shirt, but we do have some fun merchandise available. If you are interested in having a discussion about starting this program in your area and potentially being a coordinator, I would love to visit with you about what that may look like. So please feel free to email me at fosterlovewithbeef@gmail.com. Again, thank you so much for your time today and for letting me share my weaknesses and the hope and the strength that came from them. I hope it inspired you to share yours as well.
Jessie, thank you so much for sharing this passion project. I'm thinking back to a time when I had a friend who really worked within the foster system and as a volunteer. And I remember her telling me that she had a set of siblings who had never eaten meat. Like, so for them to actually get a hamburger, they just sat there and stared at it for a while because they couldn't believe that they actually had meat, much less a cooked meal, an actual meal every evening. So I'm thinking about what you're doing for those children, just on that side, just like the relief of I'm not going to have to go hungry tonight, by getting your entire community involved. I do have a question. So I know that people are donating local beef, but if they are not a farmer of any type of livestock, are they able to like go to the store and produce or purchase meat and donate, or like maybe monetary donations?
Yep, they can. So we definitely accept the monetary donations. Like we said, very slow start with that as we primarily were focused on the beef donations. But no, we've had a few people who have gone to the store and purchased stuff, or they've said, gosh, I really want to donate, but our freezer's not full. Can we do that? And that's totally fine. There's actually a kind of a clause in Nebraska that as long as the beef being donated is fit for human consumption, that it is acceptable to be donated if it's donated in good faith. So that's kind of our big focus. I actually had somebody this year that donated, because I know people have asked too, like, does it have to be a locker? Does it have to come from a USDA locker? And it doesn't. I had people that honestly process their own beef. And this year I got like fresh roasts in a Ziploc baggie. And I thought, whoa, that's new for me, but it looked great. The beef was great. So that was it was a wonderful blessing, but definitely has been a little learning process. And
Sure,
yes, you can
sure.
definitely, yep, donate financially as well. People can email. I get checks in the mail occasionally. We do have PayPal available as well.
Okay. We have a few comments that I want to go over. Leslie says the growth of this healthy program for physical and mental health is benefiting the giver and the recipient. So yes, you get a reward if you are the giver as well. So she says,
Mhm.
thank you for your part to obtain the program and share it with everyone today. So Melissa says, this is one of the things that I was talking about earlier is I love whenever we bring speakers on and then someone in another state goes, like Melissa just says that you've got my wheels turning.
Yeah.
People love your programs. It's just not maybe something that they've thought about at the time, thinking this is super for my community as well.
Hmm. Hmm.
Um, Alberta says, have you reached out to local nutritionists and dietitians to work with families in need?
I don't know if we have specifically reached out to them. I mean, I have a couple friends who we've connected with a little bit, but in working with the Beef Council, they've been great about, like I said, kind of providing some of those resources. But that may be an option as well. Yeah.
Yeah, yeah. So we have lots of thank yous, fantastic, inspiring story. Abby would like to connect with you. She is from the
Yeah.
University of Wyoming Extension, where they work with
Perfect.
low-income families. She wants to learn more about how you're doing this. Um, Christy says, life-changing, inspired me. Hannah says, thank you for your presentation. High quality food is such a gift. Yeah, especially when it's straight from the farm. That's pretty awesome.
Hmm. Yeah.
Um,
Yeah. It's been a
so
blessing.
while we're thinking about this, like I know that you do it specifically for foster families, but immediately
Mhm.
my mind went to when you have such a close-knit community like that, when a family has a tragedy on the farm, a death, maybe the farmer has gotten cancer and cannot do all these things. I'm thinking that can actually be implemented into some kind of community program as well, because like I specifically when I had my car crash. I could do nothing for an entire year because all I was doing was healing and having one reconstructive surgery after another. Our
Hmm.
community bringing food to my family of six,
Huge.
the mental health, like the stress relief of me and my husband was unbelievable, because trying to feed a family of six it's a feat and you have to do it every single day.
Hmm.
And then,
Yeah. Yeah.
like my husband was working all day and then had to come home and take care of me. I'm thinking, man, I mean, just there's so many different ways that your program can be used and altered. And I just like everything that comes from the heart, even though I know it's probably really difficult to get this thing started and get it off the ground, when you do stuff out of passion like you are, it always succeeds because everybody wants to get involved.
Hmm. Hmm. Absolutely. Absolutely.
If anybody wants to unmute, feel free to unmute and ask Jesse questions as you please. But when we get done, Jesse, I'll let you look in the chat because there's all kinds of good things for you
Yeah,
to
I
look
can see
into.
it. Thank you.
All right. Well, you guys feel free. If you guys have something that comes up, go ahead and put it in the chat, or you can direct message, if you don't want it to be public, Jesse on that. But we'll be sending out her information when we send out the recording of this so that later on, if you come up with something, you'll be able to contact her directly, or, maybe you're like Melissa and your wheels are turning saying, how can I do something similar in my community? You can reach out to Jesse and say, how did you even start? Because that's the
Yeah.
biggest part. How do I start?
And that is great, is that we can, under kind of where we started, we can easily branch out to different regions. So please do reach out. Don't feel like you have to
Yeah.
start fresh. I would love to work with you and see what we can do in your regions as well.
That's wonderful. That's wonderful. Okay, Jesse, I'm going to let you stop sharing at this moment. And we thank you so much for being willing to conquer your nerves and get through and share everything. I do not see Michelle in our room. Michelle, if you are here, go ahead and unmute. We do have someone. Okay. I don't think she's here. I did call and leave a message. She didn't answer, and I'm really hoping that everything is going to be okay on her end. It's not a normal thing unless something does happen right at the last minute. So we are fortunate today that we have Natalie Roy from AgriSafe on, and it's been a little bit since we've given an update on the AgriStress helpline. So she has volunteered to fill in as our second speaker and just get everybody kind of up to date because we have added some states on there and we're pretty dang excited about it. So, Natalie, I'll let you go ahead and unmute and go ahead and share.
Okay. Thank you so much, Carrie. And I'm going to go ahead and get my screen up here and share it. Let's see. All right. And I know that we might have folks that are new to the Innovation Exchange. And so thanks so much for joining. We are really excited about this monthly exchange of ideas, and Carrie has done an amazing job being our fearless leader and finding great speakers across the country. And really, what impresses me the most is the fact that our attendance is always still up and high, like it hasn't gone down. And so it really speaks volumes to the fact that I think people are learning from each other, and finding a lot of inspiration from hearing from folks. So I'm fortunate to be the CEO of AgriSafe. I've been involved with AgriSafe since we started almost 26 years ago. And really, the idea of having Jessie speak here came about when we were just learning about what she's doing. And she's been with us only since the summer. And we thought sometimes the great work right in front of us, we're like, wait a minute, you need to share this with folks. And I think that it also speaks volume with what she's doing with this program is how much farmers care about each other. You know, they take care of each other, they look out for each other. And I think it's just a beautiful example of, the work that's being done at the local level that has the ability to scale up. So I do hope that you all reach out to Jessie and uh, continue to think about collaborating with her in ways that can help grow that program. A lot of talent here at AgriSafe, so we're very proud of that work. So going back to what I had suggested to Carrie, I would love to give you all an update about the helpline, the crisis line, and then about a few other mental health programming that we have. And if Carrie, if the speaker that was slated does come on board, just kind of nudge me and interrupt or something, because I want to be able to leave some time for that. So sharing with you all, make sure I'm sharing the right screen here. Okay, the helpline. So the AgriSafe AgriStress helpline has been available for several years in about 11 states. And one of the things that we really are looking to do is to encourage people, if you're in one of the states where we have the helpline, encourage you to think about what you can do to push that number out. And so on our website, we created all the digital assets that you can easily download. And well, the ones that are digital, like you would have them on like your social media, and then there's ones that you could download. So I'm just sort of scrolling through here so you can see the logos, you can see the print materials. So for example, if you're from Washington State, where we have the crisis line in Washington State, you can go and you have an event coming up, you can go ahead and print these documents out to have ready at your event. And we really think it's critical that folks leverage these resources, because the money to promote the helpline is not robust. It's minimal. And so we're asking folks to do their part and think about, for example, if you represent a farm commodity group and you put out a newsletter to your members, to your farmers, can you put the digital asset on your newsletter or get it on your website? So you can see the logos that I'm sharing are all designed to be placed on a website or some digital fact sheet. You can also, some of our states have great social media work, like for example, in Texas has a lot of robust materials. And so you're very much encouraged to take these materials and then push them out, because if they come from from other folks other than the ones that are running the helpline or overseeing the outreach, then it shows that there's a real community engagement in that. So I just wanted to show that to you, and I'll go back to our website where all that is. So here's the helpline page related to sharing the helpline materials, and you can see all the states where we have the crisis line operating. So feel free to go straight into these state specific. I'll give you an example, like Colorado. Go straight in here, and then you can go ahead and grab whatever ads are there. Now I know this is only in 11 states. The tricky part about this crisis line is that if you are from a state that we don't serve, and let's say you call the line, we have to answer it because the crisis it's a crisis line. So we can't say to anybody, let's say someone from California calls, we can't say, well, you can't call our line because we don't have a contract with anyone in California. Because it's a crisis line, we have to service the line. And so that creates a great burden on the 11 states because really, anybody in the nation can call. Now, we're not encouraging national promotion of the line because we don't have the resources to support that. But what we are looking at is trying to pass legislation that funds this on a national scale. Because once you fund the crisis line on a national scale, then you make it easier for groups and national organizations to promote it. And the dollars that go towards a line at the state level can really go to great organizations to promote it. So if you have an interest in this line in your state and you don't have it, feel free to email me. I'll put my my email in the chat. We are getting a lot of interest from other states. The tricky part to sort of factor in is that the cost per state is $1 per producer according to the 2022 census. So if your state has 70,000 producers according to the 2022 census, the cost for AgriSafe to operate this line in your state is 70,000 per year. But we know that you have to promote it, and we suggest at least a 1-to-1 match. And we recommend that those outreach funds stay within the state. So go to organizations, your Department of Health, your land grant institutions, and we certainly will work with those organizations. Again, we feel like having one national line then takes the burden off of state organizations to fund the operation. So you wouldn't have to pay that 70,000, and you put your money towards promotion, which is really allows it to be much more efficient. We are seeing some confusion from folks about, okay, how does this relate to 988? And just to let you all know, this is staffed by professionals who also answer for 988. So when someone calls the helpline, they're talking to a professional, a crisis specialist who's also trained to answer for 988. So there's not a difference in the quality of the expertise of the person answering the line. And there's a lot on our website about how it was built, the design of it, who we partner with to service the line, which is a nonprofit, a lifeline center. AgriSafe didn't go and hire crisis specialists and take on that responsibility because that is a whole specialty field in itself. So we partnered with a nonprofit called Via Link that is a lifeline provider in the state of Louisiana, and they customize this line. And it's a very tight relationship where we're constantly training their crisis specialists on the ag side and on things happening in the state that people need to know about. For example, with the natural disasters, if we said, okay, you need to watch out in Virginia, with the Hurricane Helene, they have issues there. Our job is to make sure the crisis specialists have the information. So if someone from Virginia calls, they understand the specific needs of farmers in Virginia. So it's a very customized line per state. The crisis line specialists do their work in the crisis space, but are also supposed to understand the resources for that state. So there's a lot of information being fed to the crisis specialists. I mention all of this because there tends to be some confusion, on the outside. Well, what is this helpline? And those of you who work in the crisis space and understand how important 988 is might think at first, well, wait a minute, last thing we need is another helpline that doesn't have the best people answering the line that aren't lifeline trained. And this is a lifeline trained specialist. And that was absolutely important to us when we designed it. So there's a lot on our website about the design of the helpline. And I know we have a very diverse audience here. What we're really charged to do is make sure that any state we operate the crisis line, any of those 11 states, that we're working closely with the 988. So we're seen as complementing their work, not competing with their work. And there's many strategies that we work on to do that. And so like I said, please reach out to us if you, even if you're not crazy about this concept or you think it detracts from other programming, the more we can understand how people are feeling about it, the more that we can adjust. So I'm happy to have that dialogue. So that's related to the helpline. And also just to kind of confirm again, just remember it is a 988 for the farmer, but it is also acts as a 211. And if those of you are familiar with 211, you would know that 211 is really your resource line for your state. So most states have 211. If you call 211, you'll be able to find out about resources of the state. And so this is supposed to be both customized for the farmer. Any questions about the helpline? I'm going to just show you all one other thing too. Let's see, anything in the chat?
We did have,
Okay.
if it moves forward on a national level, since it is
Uh-huh.
already connected to 988, would you eventually be able to dial 988 and then if you want the AgriStress helpline, like hit number one, option one, or something like that?
hmm So that's a good question. So it is the same name in all 11 states, same number. Um, And if you look at specialty lines, you'll see that like you can call 988 and hit a number for the LGBTQ plus line, and that person gets routed to, I think, one of four organizations that answer that. And I think Trevor Project is one of them, and a lot of people know Trevor Project because they're really a leader in this space. So it is possible that it would exist in both ways, meaning we would still maintain that 10-digit number, but if it were to have an option in the queue to through 988, then the idea is to get that caller, if they came through 988, get them sent to then the specialist who really has a deep dive and understanding of agriculture, so that there wouldn't be anything compromised in terms of the quality of that. So it could function similar to the LGBTQ plus line or the veterans line. There's a lot of discussion at the national level about like putting so many people in these choices, because when someone's in crisis, the more, and they call 988, the more that you give them choices to call, then you're holding that person in a crisis without getting them the support. So one could say, we've seen an increase in deaths by suicide among the healthcare provider sector. So someone could say, well, should they have the option? So I think that that's to be determined in terms of how that might work. But we are having conversations with SAMHSA, because whether they come to this line through 988 or they come through the 10-digit, our objective is to make sure they're talking to someone who's specialized in this space.
Yeah, and I believe like whenever AgriSafe started doing all the research and sending out surveys, that was a big stressor, I guess, for the farmers and ranchers who did call, was they needed someone who understood why agriculture was stressful.
Right. And that's why the people answering this line are all farm response trained. And I know that in past um, innovation exchange, we've been sharing about farm response. I think it's worth mentioning that the coverage in farm response has expanded significantly in terms of the free seats. So I want to just let you all know that this particular training, which is what all of our crisis specialists that answer for the helpline are required to take this is also something that we're seeing a big uptake on, and it was been added to the Suicide Prevention Research Center's Best Registry, it's the only course that is related to the ag population in this registry. So we're really proud of that. But this map is critical. So if any of you are from any of these states, know that you can take the farm response course at no cost. Okay, and there's a whole process for that. And I'll go ahead and put that in the chat. We really want to advocate for this because this is by having folks trained in this space. I don't know, maybe I thought I had it. The more people that are trained in farm response, then especially if they're in a caregiver or counseling role, then the more folks that can we can add to our directory, which is just jump to that real quick here. So this is the provider directory that AgriSafe created, where we take folks that are farm response trained who are able to see farmers and provide therapy, and we make it searchable. So we're sort of matching. We're trying to match the farmer with someone who has dedicated some training to this space, because we're hearing from farmers that they get frustrated when they talk to someone that doesn't understand their stressors. So lots happening here. Here at AgriSafe, and certainly we are so dependent on our awesome partners and our collaborators throughout the nation. And then I did want to just bring to your attention, because some of you might be new again to this innovation exchange, or some of you might have been coming to these regularly. And either way, please continue to spread the word on it. We feel like this innovation exchange that we do every month is really a shining example of why we exist as an organization, is bringing people together to find ideas. And so, and Carrie probably has explained this in the past, all of the old meetings you can catch up, and you can look at the videos, you can watch them at your own time. You can also, we really would encourage you to be a flash speaker. So this is on this page as well to the left, because we, even if it's only 5-10 minutes and that's all that you're willing to do for folks to learn from you, is really pretty awesome. So please think about doing that. And I can drop in the and we can, and even if you're like sort of on the fence, you're like, I'm not sure that what I'm doing should to make the cut of this, and we would probably say yes, it is. If it's important to you and you feel like it doesn't always have to be a direct link to mental health, like you saw with Jesse presented today. There's a lot of mental health components of that, but if it has to do with the wellness of people who work in ag, we really want to make sure to share it. So please think about that. And my last plug here is this is our innovation exchange, and we're really trying to bring people together in this space. And if you look at the logo here, you can see the hands. I don't know if I can scroll in a little tighter, but maybe I should go back to, okay. Well, this is probably the better picture of it, but this particular logo where it says AgriStress Response, we had developed that several years ago, and you can see the tagline says responding to restore hope. And we worked on this for a while, because what we were trying to do is we were trying to figure out a way for folks to remember that, because we have a lot of programs at AgriSafe, and it can get a little confusing, like, okay, is it the helpline? Is it directory? We really have put a lot of time behind this for folks to think about that together we can do this work together. And so we have created, and this has been in place for a while, but we haven't always pushed it out. We have created a AgriStress Response Partner Pledge, meaning that you can join, saying that you pledge for yourself or your organization, and you pledge to become a partner. And all we're asking you to do, and you can see what the information is on that, is to advocate on behalf of the farmer and continue to work towards this. And then what happens is you can get a digital badge that you can use. And we think that this brings attention to sort of this national movement to say we want to continue to advocate for the farmer. So please consider joining as a pledge, and we'll go ahead and send you all a follow-up invite for that by email, since we have your email, and say would you pledge. And it's really looking to pledge to support this work. And it's not a monetary thing. It might be, for example, if you are in the state where we have the crisis line, we ask that you pledge to do what you can to promote it, to push that out. So we'll provide some follow-up information on that. I know I squeeze a lot of things in, Carrie, that I added this and added that, but really excited about this work. Does anybody have any questions for me?
Yeah, feel free to unmute if you would like to answer or ask a question directly. I did answer a couple in the chat, but feel free to go ahead and unmute and ask Natalie anything that you desire.
Also, if there's anything that, oh, sorry, go ahead.
No, I was going to make a comment just that I feel that farmers and ranchers have been at the bottom of the list for a very long time, and AgriSafe is dedicated to bringing them to the forefront to say, hey, we are a career as well, and we have a lot of stressors just like the corporate world, and getting help to our farmers and ranchers, and also just educating them that it's okay to get help and removing that stigma. Like AgriSafe and AgriStress is very much on top of that and dedicated to bringing all that to the surface.
Mhm.
We did put some links in there. I went ahead and posted a link directly to where Natalie was sharing that on our AgriSafe page, and then she also put the farm response in there too, because we would love to keep continuing and growing the farm response as well.
And also, if there's any, I know we have a little bit of time. If it's okay, Carrie, if anybody has anything that they want to share to update the group on maybe their programming, and because we have a few minutes here, we're happy to have you do that. Um,
Yeah, just go ahead and unmute. If you have a project that you've presented on here before or something new that you'd like to share with our group, go ahead and feel free. We've got about 12 minutes that we can go ahead and do that. And then also, each month I like to remind you, our AgriStress Facebook page is public. You can actually post whether you have a new project, maybe you have an event coming up, or something that you just need help getting out there. You can post it to our Facebook AgriStress page, and then one of us will approve it, and it will be shared. If it's too much for you to be able to do that, either send it directly to me or sign me up or send me the link to your newsletter. If I get those in my inbox, it's an immediate reminder for me to say, you know what, we need to share this on our AgriStress page and help you get that out there, because we are all about promoting and working together within this group. And it brings us such joy to be able to share what you're doing within the AgriStress or the mental health and agriculture community as well. I'll put my email in there again.
May I share something?
Please do.
Um,
That's Leslie.
so Morton County, Kansas is very, very small, 2,300 people, and they had considered a high rate of suicide. Um, their ag instructor, their extension agent committed suicide, and then there were several kids kind of within a few months, 5 to 6 months of each other. And so the coalition was formed to address how we could help, this crisis. Anyways, long story short, they got together, and they do have 988 actual physical kiosk in 3 different small communities in Morton County. And that's how it got started. But I have been looking for more help for our ag community because it is largely ag in Morton County. And this has been a phenomenal avenue. So I'm hoping to get Kansas and Oklahoma, because I live pretty much right there on the state line, to implement this program for our ag producers.
Leslie, can you add I don't know the 988 kiosk. I may have been the only one who have not heard of these, but I would like more information. Can you explain what happens? Is it something like they talk directly to someone right there?
Yes. So it is actually a physical location in each community. A person can go into the building, and those were all donated. Those locations were all donated. The telephone line, when you pick up the handset, it immediately connects that person to 988. There's also information for other resources. If they're not really calling, they're just looking for help, and they know they can go there to look for resources to find help. Initially, we will have iPads mounted in there so people could do telepath if they need to. We're working on that. So, like I said, they could just go in there and pick it up, and we don't know who's in there. We do know that they have been used a couple of times, and one of those times was a trucker had called 911, and he was just distressed, and they got him to the one in Rolla, Kansas. It was right there on the highway, and he was able to get help. And of course, the law enforcement just went to do a check on him, and he was doing better. So that's our story in Morton County.
Okay. So that was one of my questions is I didn't even think about truck stops because in my small community we do have a truck stop, but I was thinking, where do you find Christ, where they can go into a building 24/7 because a lot of stuff happens in the dark of the night when you're alone and you're talking to yourself. So truck stops would be a great place to have that. So is it those kind of establishments? The other thing I was thinking was libraries, just because it's a quiet place. And then how do you make sure that there's no one can hear them with that? Or like, do you have like a link that we can share in the chat for people to go to that?
We have a Facebook page that we do our post on. We do not have a website. The county has one that we're supposed to be on, but it is buried so deep in their levels on their website. That's something that we're working on. This plan of action's only been around about a couple of years, and it's all volunteer. So we don't have paid staff other than a little bit of grant work trying to get it out.
Leslie, if you find that later,
or my
I would say if you find where I can send out
address.
that information, we'll send it out in our email list with the link to the video because that I would love. That's really interesting to me, and I think some other people are probably kind of mind blown as well right now.
And I can add also,
Okay.
there
I
is,
can.
oh, sorry, go ahead.
Did you have anything else, Leslie?
No, I did not, but thank you for the time to share our story.
Absolutely. We appreciate that.
And Leslie, I put in the chat, this is Natalie again, I put in the chat our mental health lead, Dr. Tara Haskins, her email, and then mine again. We do have you said in Kansas, you're in Kansas. I think we do have the ability, oh, sorry, go ahead. But I saw you talking. We
Our
have
bandwidth
some
is really low.
bandwidth. Okay, we have some funding to provide QPR trainings in Kansas and some Midwestern states. I didn't share about our QPR trainings, but that would be a really great program for your community, especially with what happened. We could offer that, figure out how to offer that virtually. So please follow up with myself or Tara, and we can kind of have a side conversation with what we can do to help you with your community. And many of those, we're going to provide the resources that aren't at cost because it's hard to do this stuff on a local level. And then also I am sharing my screen because you had mentioned about the youth, the impact of the youth. We have a wonderful module that was developed that from one of our key staff, Abby Cars, and other staff as well, taking all these modules and putting them in a self-study format. And one of them is Cultivating a Healthy Mind, and it's for the youth to take as on their own time. So I would encourage anybody on this call to access these modules. The students, basically they are assigned, the students are assigned these modules to take for homework or during class, but there's 7 of them, and a couple of them do have the mental health component. So I would encourage you to check that out as well, and I can put that in the chat.
All right. If anybody else has anything they would like to share, feel free to unmute or put it in the chat.
Can I say something?
Yes, absolutely.
Hi, my name is Shonda Blocker, and I run a nonprofit for mental health. It's called Creative Mental Wellness. I started it because I'm trying to fill in the gaps of the mental health care system. I'm a nurse, but my mom died in 1985 when I was 16, and I'm from rural Northeast Texas. Currently, I'm in Houston, but we still have a farm up in Mount Vernon. And when my mom died in 1985, there was nothing in that area because it's 100 miles northeast of Dallas, between Texarkana and Dallas. And there was really essentially no resources for a 16-year-old back then. And so ultimately what I'm trying to do is to come up with things to try to fill in those gaps. And I've got several programs I'm working on, but I'm trying to make friends with everybody and, trying to reach out and collaborate and whatever. So anybody that's interested in seeing exploring some ideas and stuff, it's creativementalwellness.org. And we've got several programs that we're working on for different things. One thing that we did a couple of weeks ago here in Houston for the second year, we hosted Mental Health Resources Day, basically an opportunity for the community to find out what's available for treatment and support for mental health, behavioral health, substance use disorder. And I'm trying to expand that. Ultimately, I want it to be everywhere nationally, but you got to start somewhere. So we started in Houston to do it annually, and I'm going to try to expand that to other Texas cities this year. But I'm trying to make friends everywhere so that we can figure out what we can do together, because I think that's how we're going to be able to bridge those gaps, is to work and collaborate and you use what we know and what we know is needed, kind of thing.
Yeah, I'm totally on board with that. Christy wants to know, do you partner with schools?
I will partner with anybody because I'm actually a ventriloquist, and I created Daisy the mental health dachshund, and we have a YouTube channel. And so I'm trying to start, we talk about mental health topics. And so, because I know that kids need to be able to start talking, we need to start some of these conversations with kids, because there's a lot of information out there, but it's not sticking. It's not right. I mean, it's not enough. And no disrespect to anybody who's been working on it. It's just that we've got to do a better job together and pooling our resources and collaboration. And so I came up with Daisy to try to figure out. I mean, I haven't started doing in-person puppet shows yet, but I'm going to try to figure out how to use her too, so that whatever we can do to try to talk to different populations, kind of stuff.
Yeah, I think that's a great idea with youth, because they need something that it it draws their attention, and your creativity with bringing something directly to them that is also entertaining makes them sit down at least and then listen later. So in the chat, Chandra, there is a link that Trish put in there that she would like you to go to for Texoma Health Foundation, that might be something that you can get some ideas or collaborate with as well.
Great, thank you. I appreciate that.
Yeah. And then we'll go ahead and share that to our AgriStress Facebook page. But at some point when you're ready, if you would like to give a full presentation to our group, just let me know, and we'll go ahead and get you scheduled on one of our months.
Oh, I would appreciate that. Thank you so much.
Yeah. Yeah. Okay, we are at the end of the hour, and we will go ahead. It's usually within 24 hours. We'll go ahead and get you an email out that has all of the information that our speakers shared, their contact information, and then the link if you would like to rewatch this meeting or share it with your colleagues. We always appreciate that. So everybody, thank you so much. I was already thinking about March. We will see you at the very beginning of March and the start of spring. So thank you everyone for attending again.
Thank you.